History will judge us by how we treated the most vulnerable and the poorest in our society during this pandemic. Today, the ONS has revealed that the lowest paid are disproportionately more likely to die from COVID. Among them, care workers are twice as likely to die compared to NHS workers. We also know that there have been at least 6,600 deaths in care homes since the start of this pandemic. It has become clear that the social care sector has been something of an afterthought in the government's pandemic planning. The Prime Minister himself has acknowledged that there's an epidemic in care homes, and we must not forget the hundreds of thousands of people who receive care in their own homes, some of whom will have died from COVID and will be lost in the community statistics. We're talking about individuals of all ages who may be frail, have complex conditions and significant needs. And we're talking about staff who are often forced to work on national minimum wage, 0 hours contracts with only statutory sick pay. When I asked the Secretary of State for Health and Social Care on the 11th of March if he would be issuing PPE to social care, he said, and I quote, "We are taking that into account." Staggeringly, it took until the 15th of April and thousands of deaths before he announced a plan for tackling coronavirus in social care, including measures for getting PPE to providers. In the meantime, councils and providers were struggling every day to get hold of it. With domiciliary care staff visiting many different households in a day, and residential care staff often working in more than one setting, this delay in getting vital equipment to the front line has undoubtedly cost lives. What assurances can the Minister provide that all social care providers now have access to the protective equipment they need to keep both their staff and their clients safe? On testing, it is very welcome that provision has been expanded to ensure that all those working and residing in care homes are able to access testing. On the 23rd of March, I raised in this House the dangers of discharging patients from hospital into care homes without testing, but policy change came far too late. The long delay in access to testing has enabled the virus to enter care homes with a lethal impact, spreading like wildfire. It has also been reported that some care staff do not wish to take tests because they are concerned about the financial impact of taking time off work. Statutory sick pay is simply not enough to survive on and must be addressed urgently. And we must not overlook the impact of the crisis on the well-being of care staff. Many are experiencing things they have never been trained for. Some fear they are being blamed for the spread of the virus, and some fear that they may suffer from PTSD at a later date. What measures will be available to support their mental health? Mr. Deputy Speaker, it is absolutely right that we champion the NHS and, in the words of the Chancellor, give it whatever it needs to cope with the coronavirus. But we must do the same for social care. We know the extra funds granted to local authorities do not go anywhere near far enough. For too long, social care has been the poor relation to the NHS. Reform has been kicked into the long grass time and again. This crisis has brought into sharp relief just how important social care is in enabling the NHS to function well. It has also brought into sharp relief the many problems facing the sector.